the whole field of multiple myeloma has gradually shifted from chemotherapy towards immunotherapy. I think today you can treat the patient that's newly diagnosed without chemotherapy for sure. You can even treat a relapsing patient without chemotherapy. And you can treat the next relapse also without chemotherapy. So you can use immunotherapy in many lines for multiple myeloma. That makes myeloma actually a very unique disease. I don't think there is any other cancer at this time that has come that far. What we do know with these immunotherapies is that they're very, very effective. They're usually very easy to give. The T-cell engagers, they're injectables, or some of them are still infusion drugs that require IVs, but many of them are injectable. The side effects are usually around the first dose or the second dose sometimes, where you have what's called cytokine release syndrome or immune cell associated neurological syndromes. So it could be fever, drop in blood pressure, and in very rare cases could have more severe clinical implications. And the neurological toxicities could include headache or pain or things like that. That's very rare. It's usually the cytokine release syndrome that bothers the patients. So what we did at University of Miami was that we gave a single dose of Tocilizumab, which is an IL-6 receptor antagonist, to every patient before they got the Tocilizumab drug. And what we saw was that the rate of this cytokine release syndrome dropped from, reportedly from the literature, 75% of patients down to 10 or 15% of patients. So that's a very big improvement, obviously. Patient could really get the drug without any side effects at all for the majority of patients. I think what this means is that you actually could have a vehicle to develop outpatient delivery of these drugs. There still will be need for a system to monitor the patient because it's not 100%, but they are all grade 1, the patients we have seen. We don't know if you do 1,000 patients, maybe there are still grade 2 or grade 3, so you just need to know. But I think it's a huge step forward, and I think we will see more of this going forward.